You might have heard the goofy saying, "It's all in the hips." Well, I'm here today with a dismembered Mr. Bones to explain how true that goofy little saying actually is. Not only do your hips act as a bony weight distribution system, allowing the mass of your body to pass through your sacrum, then down and out through the hip joints, but it's also the anchor for muscles and structures which directly and indirectly support most vital organs, as well as the origin of most of your functional mobility. The pelvis is kind of a big deal. This is a brief exploratory video to introduce some of the main anatomical features and function of your pelvis to help you in your journey of becoming a master of your own body and reduce risk of injury. We won't cover an exhaustive list of all of the muscles and functions that are connected to the pelvis because I'm trying to keep this video under 10 minutes. But my hope is that after this video, you'll have a heightened understanding of basic pelvic anatomy, or if you're already an expert, this will just be a little review. It may be helpful to watch this in a location where you have room to come into standing. A mirror where you can see the length of your torso, as well as stickers or sticky notes to use as visual cues, may be helpful, but are not necessary. Let's start with a quick review of the bony anatomy of the pelvis. The pelvis is made up of the ilium, ischium, and pubic bones on the right and left side. The sacrum connects the iliac spine at the SI or sacroiliac joint, which is a synovial joint. Your center of gravity, while standing in neutral, should be located right in front of the sacrum. Take a second here and come into standing, visualizing your center of gravity. If you're unfamiliar with the concept of center of gravity, go watch my head, neck, and spine alignment video, then come back. The body is able to move in many positions, which is why we're able to express ourselves in so many fun and creative ways to come into a variety of poses that serve our daily function. When it comes to normal walking and standing stance and the impact of the compounding downward force of gravity, the structures of our body were designed to work optimally with the center of gravity just anterior to the sacrum. We'll circle back to this concept a little later in the video when we talk about the positioning of our pelvis. The anterior aspect of the hips are joined by the pubis symphysis, which is a non-synovial cartilaginous joint. The ischial tuberosities, aka your sits bones, are located on the inferior posterior aspect of your pelvis. The acetabulum is a bony socket of the hip joint, which is where the round head of your femur articulates as your leg moves. Each bony feature, the bumps, grooves, and smooth surfaces through the pelvis, serve as anchors for a variety of muscles and structures spanning from basic bodily functions to complex movements of the core and lower extremities. Next, let's zero in on one bony landmark that will help us understand basic pelvic positions and your unique pelvic alignment. Feel for the bony prominences at the anterior aspect of the hips, where it's protruding forward the most. This is your ASIS, anterior superior iliac spine. I've placed stickers on mine for a visual reference point. You can do the same if you would like. Feeling these bony prominences during your normal standing position might inform you on if your hips are level or have a lateral tilt. What is a lateral tilt, you ask? Visualize a flat surface along the top of your pelvis. If you placed a handful of marbles on top of the surface and they roll to the left, this means that you have a left lateral tilt. What causes a lateral tilt? Well, it can be a few things, but here are two possibilities. Some people have one longer leg than the other, which would place one side of the pelvis higher than the other. Another possibility is over-tightness, weakness, and/or imbalances of the iliopsoas muscle, which is a muscular link connecting the lower back and pelvis with the femur. This may lead to lower back and pelvic misalignments and may trickle up to be a variable in scapular and neck pathologies, as well as trickle down to cause pathologies in the lower limbs. We can also use the marble visualization to conceptualize pelvic anterior or forward versus posterior or backward tilt. If you're joining along in this exercise, engage your core to avoid hyperextending your back. There's a natural, slightly forward or anterior pelvic tilt in our neutral stance. Visualizing a flat surface on top of our hips, the marbles would roll forward. While activating your core, you can exaggerate this tilt forward. This creates a lordotic or excessive anterior curve in the lumbar spine that can be problematic. It doesn't allow for optimal weight distribution from your upper body to your hips. Instead of your pelvis being positioned as a landing pad to support the compounding force of gravity, your lower back is taking the brunt of the stress, which can cause lower back pain and even long-term injury. If we go the opposite direction and tilt posteriorly or backward, the marbles will roll off towards the back. This is common in a seated slouching position. This pelvic position can potentially lead to a kyphotic or excessive posterior curve. Again, your optimal center of gravity is just anterior to your sacrum. With excessive posterior tilt, the weight of your upper body and head is placed more forward, displacing your center of gravity anteriorly, which causes tightness and overuse in your neck extensors. Let's bring our focus back to the ASIS bony landmark to get an idea of how one piece of our pelvic real estate is connected to a large network of varied supporting muscles. This portion can be done in standing, but might be easier if seated in a chair without wheels. The first muscle we're going to explore is the TFL, or tensor fascia lata muscle. Straighten your right leg. Place your left hand on your right ASIS. This is where the TFL originates. Place your right hand on the lateral aspect of your knee. Your TFL attaches here to the lateral condyle of your tibia. Move your leg out from midline. Among other functions, this muscle assists with abduction while stabilizing the hip and knee joints. The next muscle is the sartorius. Now, move your right hand on your right ASIS. Place your left hand on the inside of your knee. This muscle is attached to the medial condyle of the tibia. Now bring your leg back towards midline, otherwise known as adduction. This muscle should be contracting to assist with this muscle action. Now, rotate your leg inward and feel the muscle contract. This muscle helps with internal rotation of the lower leg, hip flexion, and adduction. Another structure attached to the ASIS is the inguinal ligament, which inserts at the pubic tubercle. Tomato, tomato. The inguinal ligament is a thick aponeurosis, which is a fibrous fascial tissue that is formed from the inferior border of the external oblique muscle. The external oblique is the largest, most superficial of the flat abdominal muscles. In addition to participation in fun extracurricular activities and self-expression, supporting surrounding structures and assisting in basic functional needs like driving, wiping your butt, and countless other examples are things that the external oblique do too. But that's not all. The inguinal ligament is also an attachment site of the transverse abdominis, internal oblique, as well as many other supporting structures. Structures that are directly and indirectly related to basic functions like coughing, breathing, swallowing, living, surviving. It would be way too time-consuming to go into all the critical structures and functions that all tie back to even just this one point of contact of the pelvis, but I hope these few examples are enough to demonstrate the foundational role of our pelvis to our movement and function and existence. Next, let's wrap up this discussion by using dance as a means to explore the hip joint. Many dance styles require us to position our thighs in parallel, internal, and external positions while maintaining control in the pelvis. All core muscles and most of the thigh muscles are connected to the pelvis. The pelvis is the link between the trunk and your legs. All of your leg movements, internal, external rotation, abduction, adduction, flexion, and extension originate from the pelvis. For example, when you kick your leg out to the front, your anterior muscles contract or move concentrically. The muscle fibers are bringing the distal muscle attachments on your leg closer to the pelvis, while the muscles on the posterior side are lengthening, allowing the distal leg muscle attachments to move eccentrically farther from the muscle origin of the pelvis. Likewise, when you extend your leg back, the opposite happens. Posterior muscles move concentrically and contract, while anterior muscles lengthen and move eccentrically. Hopefully after this video, the next time you're on the dance floor or just going about your day, you have a deeper understanding of the profound role your pelvis plays in your leg and core positioning, as well as overall basic support for your posture, organs, breathing, and ability to do you in the most efficient and risk-free way possible. Take care.